Today, I'll be presenting our research on RSA-KG, a graph-based AI knowledge graph aimed at improving the diagnosis and clinical decision-making for recurrent spontaneous abortion. Recurrent spontaneous abortion affects 1 to 5% of women of childbearing age globally, and our goal is to provide a more accurate and dynamic solution to help clinicians tackle this complex issue. Recurrent spontaneous abortion, also known as recurrent pregnancy loss, is a multifactorial condition. It involves genetic, immunological, endocrine, and anatomical factors, with 40% of cases being idiopathic, meaning the causes remain unexplained by traditional diagnostics. This presents significant challenges in both diagnosis and treatment, emphasizing the need for better tools. Existing solutions have significant limitations. Traditional clinical guidelines are static, unable to incorporate real-time data like new biomarkers. Single-modal machine learning models focus on one data type and fail to capture complex interactions between genes, immunity, and clinical factors. Finally, naive RAG models struggle to integrate structured and unstructured data effectively, making them less reliable for complex diagnoses like recurrent spontaneous abortion. These gaps point to the need for an innovative solution, which is what RSA-KG offers. Our goal with RSA-KG is to enhance diagnostic accuracy and clinical decision-making by integrating multimodal clinical data into a graph-based knowledge graph. The system uses GraphRAG, a graph-structured AI model, to map complex relationships between etiology, biomarkers, and treatment options. It also allows for real-time updates, keeping the knowledge graph aligned with the latest research and clinical guidelines. We collected data from leading clinical guidelines and expert consensus reports, along with clinical and molecular biomarker data. Using 9 large language models, we extracted relationships, such as etiology biomarker treatment, and ensured their accuracy through a multi-step process involving automated screening and manual expert review. The knowledge graph in RSA-KG is made up of nodes representing key entities like recurrent spontaneous abortion etiology, biomarkers, and treatment plans, all linked by edges that describe their relationships. We used a multimodal consensus mechanism to validate the extracted knowledge and ensure clinical relevance. This approach involved verifying the extracted triples using multiple LLMs and resolving discrepancies through expert adjudication. Additionally, we standardized synonyms and integrated various types of clinical data, including laboratory results and imaging data. The graph is designed to dynamically update as new research and data become available, ensuring it remains accurate and relevant for clinicians. To evaluate RSA-KG, we compared its performance with baseline models, including traditional large language models and naive RAG models, using a dataset of 3,000 clinical questions. The RSA-KG enhanced models outperformed these baseline models in terms of diagnostic accuracy and clinical relevance, demonstrating the power of our graph-based approach in improving decision-making. The enhancement effects of RSA-KG are significant. For instance, the DeepSeek, R1 model enhanced with RSA-KG achieved 86.5% accuracy, significantly higher than the WiseDiag-TK model, which reached only 64.6%. Similarly, other RSA-KG enhanced models outperformed traditional and medical-specific models, demonstrating that RSA-KG can strike a balance between reasoning capabilities and clinical accuracy. Further comparisons show that RSA-KG not only improves diagnostic accuracy but also enhances clinical relevance, as evaluated by a panel of reproductive experts. The RSA-KG enhanced models outperformed both traditional and professional models in terms of interpretability, clinical relevance, and diagnostic accuracy. Through case analysis, we confirmed that RSA-KG's predictions align closely with expert opinions, validating its real-world application. In conclusion, RSA-KG improves the diagnosis and treatment of RSA by providing a dynamic, graph-based knowledge graph that integrates the latest research and clinical data. It bridges the gap between research and clinical practice, offering a valuable tool for clinicians. Looking ahead, we plan to expand the RSA-KG system by incorporating more guidelines and emerging biomarkers. We also aim to develop lightweight solutions to reduce computing costs and enhance accessibility, as well as conduct multicenter clinical trials to validate the system's effectiveness. Thank you for your attention.